Why are autoantibodies so important for lupus diagnosis? Lupus is a complex autoimmune disease where the immune system mistakenly attacks the body's own tissues. Because its symptoms can be so varied and resemble other conditions, diagnosing lupus can be quite challenging. One of the key tools doctors use to help identify lupus involves testing for autoantibodies, especially antinuclear antibodies. But why are these autoantibodies so important in the diagnosis process? Autoantibodies are proteins produced by the immune system that target the body's own cells and tissues. In lupus, the immune system becomes dysregulated and starts creating these autoantibodies, which can damage organs and cause inflammation. The presence of specific autoantibodies is a hallmark of lupus, making them valuable markers for diagnosis. The most common autoantibody tested for in lupus is the antinuclear antibody, or ANA. A positive ANA test means that autoantibodies are present in the blood, but it does not automatically confirm lupus. Many people with other autoimmune conditions or even healthy individuals can have a positive ANA. Therefore, doctors look for additional, more specific autoantibodies to support the diagnosis. Specific autoantibodies such as anti-double-stranded DNA and anti-Smith are more closely associated with lupus. For example, anti-double-stranded DNA antibodies are found in many lupus patients and often correlate with disease activity, especially kidney involvement. Detecting these antibodies helps doctors distinguish lupus from other autoimmune diseases and guides treatment decisions. However, because autoantibodies can sometimes appear in other conditions or even in healthy people, their presence alone is not enough for a diagnosis. Instead, doctors combine autoantibody test results with clinical symptoms like joint pain, skin rashes, mouth sores, and blood abnormalities. They also perform blood and urine tests to evaluate organ function and inflammation levels. In summary, autoantibodies are crucial because they serve as biological markers that support the diagnosis of lupus. Their detection, especially specific types like anti-double-stranded DNA and anti-Smith, helps confirm the disease amid its many symptoms. But it's important to remember that lupus diagnosis relies on a combination of clinical evaluation and laboratory testing, not on autoantibodies alone. Always consult a healthcare professional for a comprehensive assessment and personalized diagnosis.